Hello there, everyone. You ever feel like you're riding an emotional roller coaster, but you're not sure why? Maybe you've been told you're just really emotional, or even overdramatic. Let's dive into a conversation that could be a game changer: the key differences between bipolar disorder and depression. Welcome back to our channel, where we unpack the often misunderstood world of mental health. If you're someone who's grappling with emotional highs and lows, or you know someone who is, stick around. This video is especially for you. Don't forget to like this video and subscribe for more content that makes a difference. First up, let's talk about how these two conditions are diagnosed, because, let's face it, understanding starts with proper identification. In the case of depression, you're looking at persistent feelings of sadness, hopelessness, and a lack of interest in life. You don't get the ups, it's just a constant down. Bipolar, on the other hand, is a bit more complex. Imagine going from feeling like you can conquer the world to not wanting to leave your bed, sometimes in the span of a week or even a day. Here, you've got manic or hypomanic episodes, times where you're unusually energetic or irritable, interspersed with depressive episodes. The symptoms for bipolar disorder and depression can often look quite similar, especially when a person with bipolar disorder is in a depressive episode. But there are nuanced differences that are critical to understand for accurate diagnosis and treatment. In clinical depression, the prevailing mood is, well, depressive. We're talking about persistent sadness, a lack of interest in activities once enjoyed, and often feelings of worthlessness or guilt. These symptoms must last for at least 2 weeks for a diagnosis, but often they stretch over months or even years. You might also experience sleep disturbances, appetite changes, and difficulty concentrating. In bipolar disorder, the depressive episodes can look a lot like clinical depression. But what sets it apart are the more manic or hypomanic episodes. During these periods, you could feel euphoric, excessively optimistic, or remarkably irritable. You might engage in risky behaviors like excessive spending or sexual indiscretions. There's often a decreased need for sleep, and some people report feeling like their thoughts are racing. One key differentiator is psychomotor agitation or retardation, more commonly seen in bipolar disorder. This refers to physical symptoms like restlessness, pacing, hand-wringing, or the opposite, being notably slow in speech and movements. Understanding these nuanced symptoms is pivotal, not only for healthcare providers, but for you and your loved ones to manage your condition better. Remember, your journey to mental well-being is just that, yours. Tailoring your treatment plan to fit your unique needs is crucial for long-term success. For those diagnosed with depression, medication is often the first line of defense, but there's more to it than just popping pills. SSRIs like Prozac or Zoloft are common, but there are also other classes of antidepressants, like SNRIs and MAOIs, that could be more effective depending on your specific symptoms. It's essential to work closely with your healthcare provider to find the right medication for you. But medication alone isn't the solution. Cognitive behavioral therapy, CBT, is a powerful tool used to combat depression. It helps you become aware of negative thinking and provides practical ways to change these patterns. Mindfulness and stress management techniques can also complement the treatment process. For those who don't respond to medication or therapy, there are even more options like electroconvulsive therapy, ECT, or transcranial magnetic stimulation, TMS. These are often considered last resorts, but they've been highly effective for some people. If you're facing bipolar disorder, the treatment landscape is diverse. Mood stabilizers like lithium have been the cornerstone of treatment for years. However, antipsychotic medications like Latuda or Seroquel are also commonly used, sometimes even in conjunction with mood stabilizers for a more balanced approach. Psychotherapy is crucial here too. Cognitive behavioral therapy, CBT, is again a standard approach, but other forms of therapy like interpersonal and social rhythm therapy, IPSRT, are designed specifically for bipolar disorder. This therapy focuses on stabilizing daily rhythms like sleep, wake, and meal times to better manage the disorder. Another promising treatment avenue is family-focused therapy, which involves family members in the treatment process to create a better understanding and support system for the individual affected. It's essential to note that, like depression, some individuals with bipolar disorder may also explore ECT or TMS as treatment options, especially if other interventions haven't been effective. Bottom line, treatment isn't a one-and-done deal. It's an ongoing process of trial and error. Your healthcare team may need to adjust your treatment plan based on how you're responding, so open communication with them is key. Your mental health shouldn't be a life sentence to misery. Many people with depression or bipolar disorder go on to live fulfilling lives. Support groups, exercise, and proper nutrition can all play a significant role in improving quality of life. Knowledge is your best weapon here, and self-awareness is your shield. Before we wrap up, let's demolish some myths. No, bipolar disorder isn't just mood swings, and depression isn't just feeling down. They're serious conditions that require attention, compassion, and medical intervention. So, there you have it. Two different conditions, similar in some ways, but worlds apart in others. If you think you or someone you know may be dealing with either of these, the first step is seeking help. Knowledge is the stepping stone to a better life. If this video has been enlightening for you, don't forget to give it a thumbs up. Subscribe for more content that aims to illuminate the complexities of mental health. Thanks for watching, and remember, understanding is the first step to healing. We hope you found this insightful. Comment down below to share your thoughts or experiences. Your story could be the light for someone else in the dark.